Welcome everyone to our after lunch panel on day 2 of DevDays. Yeah. I'm excited about this one. I'm so excited about the panel that we've put together. So I'm Josh Mandel from the Smart Health IT project and from Microsoft Research. And like probably many of you, I hear pervasive discussion these days around the role of AI in healthcare and how all kinds of organizations are going to use new tools to make sense of patient histories and communicate with patients and manage care and manage billing. And they're essentially looking at AI through this provider organization lens. And that is really important, but it is not the focus that we have here for this panel. When I was talking with Ward about what would make a great panel for AI in healthcare, I really wanted to spend time understanding patients as the choosers and users of AI tools. So patients using these AI tools to understand their own health, navigate the health system, explore various care options, advocate for themselves and for others. I wanted us to take a look at AI as a tool for empowered patients. And we could not have asked for a better panel to explore that issue. So in a moment, I'm going to ask each of the panelists to introduce themselves. They'll spend 5 minutes or so sharing how they're using AI, where they see it going, and how our community can help enable that future. And I should say, we'd really like to make this an interactive discussion. So as the panelists are sharing their own stories, please think about the questions that you've got for the panel. We want to save a lot of time for that in today's discussion. And I should also say that I am personally really excited about these technologies. I find them incredibly helpful in my own life as a patient. And just to give you one small example, which I promise is not contrived, on the way to DevDays, while I was waiting in the Madison airport, between when my flight was boarding and the time it took off, I used ChatGPT to help myself create a physical therapy plan for recovering from a neck injury. And then I asked it to make a web app that I could use to track exercises on a daily basis. And I could do all of that from my phone in under half an hour by using this kind of AI assistance. So there's a link to the website that I put together. It's not a beautiful work of visual art or user experience design, but it is a functional tool that was built by a language model that understands physical therapy exercises and JavaScript enough to whip up this kind of tool. There's no way I would have done that on my own. The level of effort would have just been too high. So I really do see these tools opening up all kinds of new possibilities. And with that, I'm going to turn over to Dave to share his perspective and kick off the panelist introductions.
I'm Dave deBronkart. I'm a patient data evangelist, I call myself, and I'm known for the chant, and there's actually a music video, "Give me my damn data," and I'm very much interested in the role of activated patients in improving healthcare. The reason we're having this panel focus the way it is because there's a big problem in how the industry is looking at AI in healthcare. This is a map of all the work to be done in healthcare published by Andreessen Horowitz, the famous legendary venture capitalist in Silicon Valley. And from top to bottom, there's clinical to non-clinical. From right to left, there's professional-facing to consumer-facing. And when I saw this last year, I thought, what is wrong with this picture? And the reality is, outside of the system, outside of consumer-facing, there's a lot going on out here that you're going to be hearing about in this panel. And it's not in the picture, and that's a giant mental error as people are thinking about the data, how the data is going to be used, and who needs what in order to use AI for healthcare. Grace Cordovano, who will be joining us virtually, we were very conscious of the fact that this is a manel, as it's known, all men up here. Grace is unable to be here. She is a full-time patient advocate herself and is dealing with family crises, so she couldn't make the trip, but she'll be joining us virtually. Last March in a meeting, a conference call, she said, people need to realize patients are end users of AI. We are not just the people sitting here at the end of the production line after developers develop things and hospitals use them. We have 5 categories of patient use cases, and I just learned today from Chetan, who will be speaking today, he's got additional ones. The first is patient administrative burden, which is a term that Grace herself has been touting for a couple of years. Here's one of her slides that she uses. This is just, don't read all this, I don't have time for that, but just the laundry list of things that she uses AI for all of these things. Because in the same way people use AI inside healthcare to simplify their work or make it more productive, she's doing the same thing outside. Second category, organizing records for action. I don't know if all of you have been good, empowered patients and read your medical records, but here's an example of one of my visit notes from last year. And I looked at this because another visit was coming up, and I thought, what was I supposed to be doing? And I started digging, and then I thought, oh, holy crap. I pasted it into GPT with a clever prompt, and it came back and said, here's what's going on, dude. Right? This is making me a better patient. All right? Next example, comprehension. You'll be hearing Hugo talking about how he uses LLMs to understand literature and research different options. Difficult diagnosis. You may have heard last year, in fact, this story was published on the day of the Phoenix work group meeting last year. This kid at age 4 stopped developing properly and started developing nasty problems. 17 doctors over 3 years couldn't figure it out. Mom got tired of it all last August and pasted all the radiology reports into GPT, and it came back with what turned out to be the correct diagnosis. Now, it didn't automatically for sure come up with the right diagnosis, but she, using this freely available public tool, solved a problem that the doctors hadn't been able to. Hallelujah. Is anybody opposed to healthcare getting more effective? Gee whiz, I get passionate. And then finally, exploring knowledge and options. All right, you're at the edge of what medicine has to offer. Both Hugo and Chetan will be talking about this, and Grace, I'm sure. The key learnings from this panel will be, we patients have work to do in getting and managing care. Who knew? Gosh, it takes work to do all this. AI can help our work too. Here's where you can come in. It could be immensely more focused if it wasn't just a generic literature review, but if it actually had our data, right, supplementing. I'm dreaming of a GPT that actually has all my crap from my 74 years of life in there, and I can have conversations. Hugo's starting to do this. So build us into your workflows, please. Thank you.
Hi, everyone. Thank you, Dave. I'm Hugo Campos. I'm going to just quickly give you a sense of my experience as a patient in dealing with data. So this is me. I have a genetic type of heart muscle disease called hypertrophic cardiomyopathy. I'm also a caregiver to my dad, who's 94 years old. This photo is taken a few years ago. And I've been using AI language models for about a year, a little longer than a year. I use it for a variety of different things. Mostly for analyzing my medical records, a custom GPT, helping me make decisions about my treatments and interventions. I've done that. It's very helpful. And more recently, which I'll go a little deeper into, is to help diagnose my dad's skin condition. And LLMs have been invaluable for me to navigate the complexities of healthcare. One thing that I think I want to point out to you is that I don't usually use AI for kind of in the same way that I use Google for searching. It's more about the thought process, and it's more about helping me see options and really think through the problem. So I use it to help make me think. So about 3 months ago or so, 2 months ago, my dad had a skin rash on the left arm, and it quickly spread, and very quickly in a matter of weeks. And we saw the PCP, and his PCP said, I don't know what that is, I'll send you to a dermatologist. And the appointment with a dermatologist was scheduled for August, many, many months away. And what do we do with this? How is this helpful to me? It is not. And so Dad is complaining, and he can't sleep, it itches, and it's uncomfortable. So what did I do? I took pictures of the rash, which by now had been all over his body, and I put it on a variety of different large language models. I also got copies of the visit with the PCP, since the LLM couldn't see my dad. Well, it could, but not in the same way that a doctor would. But so I put the assessment from the physician together in the LLM. I put some blood tests in there, and I bounced this stuff off a bunch of different platforms. And so really has been a game changer for me and for anyone who can use it to this level. There's a little QR code there that you have, there's further detail into it. And anybody, you can ask me if you want to know a little more. In my experience going over this process over the last year or so, I realized that there are many, many barriers, and data is an enormous, enormous barrier. I personally use a product, a service that I pay monthly for to aggregate my data and put it all together, but it's really difficult. I've had a lot of trouble collecting my records, organizing my records, and I get these enormous PDFs that are not parsable, that the LLM can't read sometimes. Very, very real challenges that I wish weren't there. So I think that when patients truly have their data and can use it, we have a tool in our hands that can be transformational for all of us. Really, the potential is incredible in my view. I'm such an enthusiast about this. Incredible in my view. So my vision for AI in healthcare is a world in which patients, all of us, think of yourself. And patients spend the majority of our time in self-care. We're not, our interactions with healthcare are only the tip of the iceberg. Very, very brief and fleeting interactions. For the most part, our lives were alone, caring for ourselves, making decisions that affect our health. So I envision this world in which patients are empowered to take control of our health and just a tad more intelligent with these tools about the decisions that we make. And I also hope that AI holds the potential to untether us from a system that is, quite frankly, costly, too complex, and inefficient. And it doesn't always work for patients. And I have this kind of dream that it will be a technology that will help bridge the gap with so much inequity that we see in healthcare, lack of access, and these enormous gaps that we see, language barriers, cognitive barriers. AI can meet patients where they are. So folks like me, patients are already using AI. All we need is automated data access to FHIR, with FHIR, and I hope you guys can help. And thank you so much for your attention.
All right. Thank you so much, Josh, Dave, and Hugo for really setting the stage here. My name is Chetan Sarabu, and we'll just briefly introduce myself and then wanted to share some additional examples of where I'm really excited about patients' use of AI directly. My journey here started as a pediatric patient, and I won't go into all of the details of it, but really at the crux of it, my brain and bladder don't communicate with each other. And that's led to a lifetime of healthcare issues, doctor's visits, but it's also what led me to then become a pediatrician and try to work from within the system to create a better way for both doctors and patients and caregivers to all seek and facilitate care. And I wear a couple of different hats, and here I'm representing Open Notes as an AI informatics strategist and Open Notes as a nonprofit organization. And we're really, with the launch of the Open Notes Lab, really exploring where patients and AI come together in many of the use cases that you've heard about today, as well as others. And I wanted to share one specific example of how I was able to use AI in my own care. I recently had an outpatient procedure for which I received a pretty hefty bill, which seemed a little bit off to me. And I was able to access my explanation of benefits from my insurance company, as well as the note from my doctor, thanks to the 21st Century Cures Act and that information being available in my patient portal. And I just put those into ChatGPT and I said, hey, does this bill look right to you? And I tried a variety of prompts saying, you are an expert medical coder versus just, does this look right to you? And I think an important aspect here that you've heard from Hugo and Dave, as they've shared many of their examples, the way in which we prompt can lead to different output. And I think there's a lot of education and room for experimentation to really help patients make the most of AI. And so for myself, when I put this in, found that there were, in fact, errors in the codes for my bill, and I was able to identify opportunities for savings. And then I was able to ask ChatGPT to write a letter to my doctor, to my insurance company, which I was able to help use in negotiating, reducing that bill. So, and that is just using out-of-the-box ChatGPT without any specific knowledge, but it was able to understand some of the complexities of medical coding. So just wanted to start with that example, but just to highlight and emphasize what Josh, Dave, and Hugo have already shared and what Grace will be going into, this is a very exciting time for patients' direct use of AI. I think it's really something that needs to be embraced and elevated. There are obviously a lot of nuances to work out in terms of the best practices, but I think patient communities over the years have shown that they're able to help support, augment each other in being able to elevate best practices. And I just wanted to mention two more things, and then we'll be turning it over to Grace in a minute. Wanted to mention a project which came out of Stanford, which may be interesting to many of you here, which is an open source tool called LLM on FHIR. It came out of the Stanford SPEZI group, which is an open source platform for building healthcare applications. That's all on FHIR. And so the LLM on FHIR tool was a way to allow you to interact with your health records, primarily through Apple Health Records, with a chat interface. So just thought I'd mention that tool in case anyone's interested in checking it out. And then the last thing I will mention is the Patient AI Rights Initiative. You might have heard of many different groups, regulatory bodies, government organizations that are trying to figure out how do we regulate AI to make sure it's safe, it's equitable, it's ethical. And what's been missing from the conversation often is the patient's voice. And one of the groups that's really taken a lead there is the Light Collective, which I myself and Dave have been part of this initiative from the Light Collective, as well as Grace, in drafting the first patient AI rights initiative of really putting out the principles and goals that we'd like to see from a patient perspective. So with that, just want to thank you all for your attention, and we'll be turning it over to Grace.
Hi, good afternoon, everyone. I'm so sorry that I can't be there, but I'm so excited to be able to join you virtually. I'm getting chills listening to all of this, and I'm so excited that time and space was created in this meeting to bring the patient perspective to this important conversation. I'm Grace Cordovano. I'm a board-certified patient advocate specializing in the oncology space, and my day-to-day is working with patients and their loved ones from point of diagnosis to survivorship or end-of-life care planning. And as I listened to what Dave was saying and Hugo and Chetan and all the different ways and methods and tactics in which patients are using LLMs, as I reflect on how I use it in my life, I'm really using them as tools to help people survive or to bring closure to a catastrophic situation where they can be confident that maybe it's time for end-of-life care. How do I use LLMs? It's such a broad question. I use it and I summarize it in 10 different phrases. Here's my top 10 triggers for when I, as a patient advocate, when I, as a patient, or I, as the care partner to two disabled adults, make a decision to use an LLM or some version of AI in my healthcare decision-making tree. When I hear, I don't know, we don't know, the word no, we can't, it's not possible, denied, no information, lack of research, not medically necessary, nothing else we can do, I'm sorry, you can go home and have comfort care, it's time to die. Any of those 10 phrases immediately trigger, let's take a look at ChatGPT. Let's look at an LLM. Let's look at an AI-powered tool and see if there's any other needles in a haystack that we need to consider. And 9 times out of 10, it unearths really important information that's critical, that causes a significant pivot in a patient's journey in their life with a diagnosis. I frequently and most often work in catastrophic situations where patients are diagnosed with cancer, something life-altering, life-limiting, and we are understaffed in healthcare. No matter how wonderful a physician and my colleagues in medicine are, they only have so much time in their day to serve and support the patients that they're seeing. It falls on patients, families, their care partners, their caregivers to start to do the work that they need to do to get the care that they need. Dave mentioned patient administrative burden. The sicker an individual is, and the more individuals within a home and household that may have many different medical situations, multiple comorbidities, life-altering limiting conditions, we have to work strategically and try to hack US healthcare. We have to do it in a way where patients are able to get the competitive advantage and to operationalize against a system that is completely stacked against them. I see great opportunities for tech-enabled, AI-enabled human touch, especially in communities that are marginalized and underserved. It is a pivotal point in our healthcare system where patients can start to level the playing field and heck, maybe even get that competitive advantage in what they need to do next. And as I look back on my own future, I'll share a personal story with you. In 2008, I was misdiagnosed with advanced lymphoma. I received this diagnosis of advanced lymphoma, took my medical records, went to Sloan Kettering and for a second opinion. Thank God I went for a second opinion and was connected with the right physician at the right time. After 4 months of different types of blood work, endless imaging, numerous failed biopsies, surgery, being placed in isolation after surgery for potential tuberculosis, I was told I did not have advanced lymphoma, but rather a fungal infection I had gotten on my honeymoon practically 2 years prior. No treatment was required, just monitoring because a healthy immune system clears this infection, which was called histoplasmosis. And I was blessed to leave a cancer center without cancer. Looking back, as I listened to Hugo and I listened to Dave and Chethan and the ways that they're using and accessing their radiology reports, thanks to the efforts of the National Office of the National Coordinator, gosh, what I would have done at that time in 2008 to take a copy of my radiology report and feed it into an LLM where I could have said, is it possible that this could be something else? Because for 4 months, I walked and I prayed and I gave my husband my blessing to remarry and I planned my eulogy and my funeral and all of those things. So as I look at patients today, we're really at an inflection point where we have access to data, where we can have tools that can help us make educated, informed decisions about our care and potentially come out on top, whether that is with a better outcome or with dignity and peace if it's the end of life. Thank you for listening.
So we want to invite audience questions. As folks maybe think about things they want to ask, raise your hands when you've got one. I do want to kick off with one question about interacting with a healthcare organization after you've gone and used these kinds of tools. After you've asked ChatGPT and gotten some different ideas and you want to go back and have a conversation with a clinician, maybe a healthcare administrator, depending on the use cases here, how important is it to find the right organizations and the right clinicians to be working with, folks who are open to this, or on the other hand, do you run into circumstances where you find yourself talking with somebody who really doesn't get it and you have to sort of explain everything from the ground up? I'd just love to hear experiences here.
I'll go. Okay. There are folks, for engagement to happen with patients in the healthcare system, there has to be a willingness on the side of the healthcare system to engage back with the patients. Some folks are too not interested or maybe too busy and may have their reasons as to why they're not able to engage. But to me, I come to the healthcare encounter with an expectation that I will get what I need. And so if I don't get what I need from that particular provider, I try to find one that would in that context. With LLMs, the LLMs are, to me, helping fill in this gap. It's making me a little bit smarter in terms of what solutions to find, at least helping me think through the problems a little better so I can better partner with the clinician. For example, I'm a little bit further ahead. For example, when I have the appointment with a dermatologist in August, I will likely be able to have a much more productive conversation with them than I would have had if I had not used the LLMs, because now I understand. I even have what I think is a diagnosis. So it will be further ahead, so hopefully more productive. So that's how I'm thinking about it.
Great. Anyone else want to comment on this one?
I can add a little bit as well. I think obviously we've had this big cultural shift, I think, over the past decade and even longer of really not seeing from the perspective of a clinician, of clinicians not being this paternalistic figure, but rather move into partnership and dialogue and shared decision making, and really acknowledging that while a clinician may have a lot of medical expertise from training patient, but they're only seeing a patient for 20 minutes in a few months in a year, and that patient's 99% time lived experience is a lot of wisdom in how they understand their own body and care. And so there has been this cultural shift that's happened, and I think obviously there needs to be a lot more. There are many clinicians, physicians who are still not open to shared decision-making conversations and still have a bit more of a paternalistic perspective when it comes to patients coming in with having looked things up on Google or engaging with their medical records. But I think we're in a little bit of a different moment too with LLMs, because in some ways the AI acts as this third agent in a room where you might have a doctor, patient, and AI, and obviously there's also maybe caregivers. Doctors are using AI tools as well. They're starting to experiment with it, but also are not experts in using it. And oftentimes, many activated patients may have a lot more experience and advances in using an LLM more so than their doctor. And so I am optimistic of a new era in the doctor-patient relationship when it comes to looking for additional knowledge and collaboration because of some of the changes in power dynamics and hierarchy that may be possible by introducing LLMs, AI into the room. So that's my kind of wish for how things may change.
Just one quick thing to add.
Grace, we won't forget you. Negotiating the virtual is tricky. Grace, why don't you jump in, and then Dave.
Okay, thank you. I'm going to jump in and say, as I reflect in my encounters with patients and their doctors, when I'm in the exam room and listening and we get to a tough conversation, I feel like I need to make a shirt and say, I know about LLMs. And I do work with the National Academy of Medicine AI Code of Conduct project and try to list some credentials to say, just give me a second and let me explain. I think I'm met with 3 different types of reactions. When I start to say, we used an LLM or we use ChatGPT, I'm met with either a scoff and eye roll saying, oh my gosh, it's like the Googling patient, 10, 15 years ago. Don't confuse your Googling with my medical degree. Don't confuse your LLM with my medical degree. I'm seeing that reaction. My second reaction I'm seeing is an immediate hard no, that the physician's overwhelmed. I don't have time for this. I have way too many patients, and they immediately just put a hard stop to it and say, this is what we're going to do. I just can't take anymore. And the third one is really curiosity and intrigue, where I have my laptop or I have my phone and we're using ChatGPT, and the doctor will really come over and swing by and we're having a productive conversation because we've hit one of these 10 trigger points that I mentioned earlier. And I don't know, we're not sure, we're the end of the road here. And we start collaborating together. So to Chethan's point, absolutely. I do feel that there's a new shared decision making opportunity here. And as soon as I see that doctor swivel over and come over and face the laptop and is ready to roll their sleeves up to be creative and curious and learn together, that's a green light.
And all I can add is we're going to need a boatload of change in medical education, teaching doctors how to not only work with patients who don't know anything, but also work with patients who know a whole lot of stuff. So it just changes the whole thing, the whole level of everything.
Yeah, I love this example of the real-time interaction. In fact, I was curious whether folks have had that kind of experience at the point of care. I can imagine that's, there's a lot on the line. The visits are often very short. So I'm at least heartened to hear that some folks are able to make time for that interaction and for that experience. It's a bright spot. So we've got a few folks in the audience with questions, please.
Hi, my name is Sivaram Arabandi. I'm a physician informaticist. So I'm coming at this from a physician perspective. I liked one of the comments that Hugo, I think, made, right? And before that, I want to paraphrase, say this, like, the promise of AI is not questioned. It's how we get there, when we get there, that's still in question. So Hugo said something like, I don't ask ChatGPT for answers, but it helps me think, right? So the question to you is, well, in this process, you ask it something and it gives you some suggestions, maybe a differential diagnosis. Maybe you ask for references for those differential diagnoses. Do you follow through on that and say, check out each and every one of those references to make sure that those are valid? Because one of the challenges that we are seeing is hallucinations. ChatGPT can very well make up references that look very, very authentic. So if you, as a physician, I'm thinking that if you get 10 references, that's going to be a lot of follow-up to do. And that's going to be challenging for any physician. From a patient perspective, that would be near impossible to do that kind of research for each and every one.
Thank you for the question. I have this thing about, shared decision making, it's wonderful. It's lovely, it's great, and I hope I have that. But like I said, most of my time I feel like I'm left to my own devices, and I have to make decisions. We all have to make these decisions. Sometimes they are not as impactful or significant micro decisions that impact our lives. Sometimes there are bigger decisions on health. Should I go to the emergency room? But the way I use these LLMs is I bounce off a lot of, I use all of them, or most of them. I haven't used the Llama as much. But all of the others, I'm a paid subscriber, and I try to get as much as I can from these. One of the services I use quite a bit is Perplexity, only because it does provide the the references. I use Google Notebook LM quite often to help me think through a multitude of data that it may not make a whole lot of sense to me. I use Claude to help me write better prompts for GPT. I use GPT to help me write prompts for Claude. So to me, it's an ecosystem in the way I use these tools. But ultimately, I decide. Maybe I'm making the wrong decisions, such as life. We make mistakes sometimes. But I'm not looking to be the owner of the truth. I'm not looking to be in charge of the decision that is the right decision. I'm trying to do my best. And I know that I'm a little bit smarter with these tools at my disposal.
And I'm going to add a comment here that might sound a little flippant, but it's not intended to be that. In 15 years of doing this advocacy for patient empowerment, a big part of the work has been cultural, trying to understand what is the culture of medicine that makes people resist this. And there's a lot of it, and I think I hear it in your question. We are trained to look for certainty as much as possible. And along the way, I discovered that there is far less certainty in the literature than we are all taught to think. I mean, half of all research papers have never been replicated by another lab. And there's a wonderful book, The Half-Life of Facts, that talks about how rapidly information, knowledge is turned over. So it's a good pursuit, but what somebody like Hugo or me will do is we'll take it as, well, that's what it said. Now let's see if that pans out. And there's a lot of work to be done along the way.
I'd like to chime in on that last question. The gentleman that posed it, I want to look through a different lens. I believe the comment was that it's almost impossible for a patient to research 10 references. The patients and families that I work with, their definition of impossible is it seems impossible for me to live without my spouse. I can't let them die from cancer. It seems impossible for me to miss my granddaughter's wedding. I need more time. These are the things that are impossible. All the other things become a realm of possible. And in response to how challenging yes, it can certainly be challenging for a patient to go through those references. But if we coach patients through it, we can find the article, feed it into an LLM, prompt it to digest and crystallize the key findings in 5th grade English lay language to start somewhere. I feel that the technology is there, but now we need to make it tech-enabled human touch, whether we're coaching community health workers. First Lady Biden just released a program for patient navigators. It's a principal illness navigation program, which has reimbursable codes for trained navigators to help support patients living with cancer through the Biden Cancer Moonshot. So there are opportunities to now marry the power of the AI tools and technologies that are out there with even human supports that can help guide patients. It's not going to be perfect, but it's going to be an incremental, significant improvement to the way life was before these LLMs came out. And if anyone wants to doubt that patients are ready or maybe are already woven into using AI, if you have a pen in front of you, just write down the word patient, spell it out on paper, and capitalize the A and capitalize the I. AI is already woven into patients. It's already built in. So we all need to catch up and change the culture of how we're perceiving patients, because that's the way to be future facing, and patients have already been built for AI. We just have to help it happen.
Thank you. That was a great answer.
Yeah, another question from the audience, please.
I would just quickly ask at first, I want to also add that I think that research can be done by patients for sure, like checking out references, because I think we're all patients at some point. So we can be medical staff even, we can be practitioners, or I don't know whatsoever. So I think that's possible, but however, my question is, do you think, I mean, either Josh or some of the patient advocates that we've heard now, do you think that the new technologies that came from using FHIR give enough opportunity and ways to identify mistakes or misdiagnosis? Thank you.
Yeah, I mean, I'll say briefly, when it comes to identifying mistakes in the clinical care process, there is nothing like having a patient able to read the notes, able to make sense of what's there. And so sometimes that's just a question of getting access to the data, spending the time to do it. Sometimes tools really help. You know, you've got a 5-page note with a lot of technical detail. Can you boil this down? And now I'm reading a summary and I think, wait a minute, no, that's not what I said during that visit. That doesn't line up with my experience. I mean, I had this for myself in one of my last patient visits, which I waited 8 months to have an appointment and, you know, had an online specialty consult. And wow, I went to read the note afterwards and there were details that were just not what we discussed. So I think surfacing that information is so important. I want to hear what others on the panel have to say about this.
Yeah, just to follow up on what Josh added, I think with FHIR, with being able to access medical records as made possible by the 21st Century Cures Act, we have more, we as patients have access to more of this information, but it's still messy, it may be incomplete, only partially there, but that's sometimes also the case on the clinician's end. And I think there's a huge opportunity here to bring together advances in interoperability with AI in many of the ways that Josh just highlighted, of being able to simplify. Sometimes you may have medical records where there's a lot of duplicate information in multiple places, and being able to use the power of LLMs to summarize that information so that you can make sure you're getting to the essence of what's being said, I think is a key part of identifying errors, of identifying mistakes in records. And then I think another part of this, and I know this is a lot of the work that Grace does, among many, is also that feedback loop of when there are errors that are identified in records, of being able to go back and correct those. Patients have the right to request those corrections, but we don't really have a great system in place to be able to go back and make those edits. And with the advances now, there's a lot of work for health systems and new tools of AI-based documentation. Perhaps we can get to a better place in which patients' voices, patients' identification of errors, or identifications of things that were misrepresented could more readily be amended in records.
I'd like to just add one last thing to this conversation as we talk about transparency in the future here. Any AI-generated outputs that are used at point of care or by a provider to make decisions about an individual's care or coordination of care need to be exchangeable, interoperable. And this is where the power in this room can help. We need standards and methods and manners and ways to be able to exchange those outputs so that they can become a part of our medical record. So we could celebrate when there is a positive outcome and finding based on the use of this AI tool, so that we can find when there's an error or when there's a bias potentially because of an AI tool. Right now, the only person and stakeholder that really has access to these AI outputs is the provider, or actually the health systems and payers. Patients are the only ones that don't have access, and we're completely on the outside on this siloed side. And we can change that by working together and starting with low-hanging fruit on standards development, whether we start with what's available in US CDI, whether we collaborate with the Office of the National Coordinator, because these AI outputs aren't going anywhere, and they're certainly going to be our future. So we need to find ways to make them interoperable and part of our medical record, recognized as part of the designated record set, and recognized as EHI as per the Office of the National Coordinator.
All right, we're getting into crunch time. So what I'd like to do is invite 2 audience questions, rapid fire, and then allow the panelists to answer the pieces that they want to pick and choose. So first, Ward, and we'll go over
and
to
just
Betty.
to add, at 3:15, there is a meet and greet with the patient panel. So any other questions we can answer at 3:15 in the break in the fireside chat there.
So my question is, As a patient, I did my research, or caregiver, I did my research and found something through the LLMs. How should I approach my physician to all the things that Grace has mentioned earlier? How should I approach the conversation so that they don't dismiss, or the level of trust with the LLMs at this point in the medical community is hallucination or whatever it is, right? But how should, as a patient, approach the conversation? Thank you.
Yeah. How much of it is in the patient's control, the way they introduce the topic, and how much of it is just which of the three groups that provider is going to be in? That's the first question. And then Vadim. Yeah.
Just a quick one. When the internet first came out and a lot of medical resources were available in the internet, people worked out quickly that you shouldn't trust any website out there, right? We should only look at medically reviewed websites. So we learned that we need to do education, right? Do you think we need similar education when working with AI?
I couldn't understand.
So I'll repeat the question, which is, in the internet, folks have had to learn what sites are trustworthy and what aren't. That takes education and some way to tell these things apart. Are we going to need a similar kind of educational campaign, and what's going to bring people up to speed with using LLM tools?
I'll answer that one first. It's a false god to pursue that. I remember very well in the early days of my advocacy, a startup got $1 bazillion. It was called Medpedia, and it was going to have authorities create a medical Wikipedia, and they died. They just failed. It turned out the patient communities did a better job faster. So long-term bet, that's my answer on that. And remind me your question?
How do patients bring these?
Easy. I start out with every new doctor by saying, I'm the kind of patient who likes to understand as much as I can. Could I ask some questions? All right, and then I'll say, look, I found this, what do you think? All right, so that continues the partnership and the respect for their background.
I'll be quick. To the gentleman over here, I actually don't share with my doctor what sort of resources I have to available to me. I just think it's an unnecessary part of the conversation. I just bring a bit of my personality, my how do you say it? Myself.
So it doesn't matter.
My style. Yeah, that's right. And some doctors are okay with that, others not. So, but I feel, because there is information asymmetry, I feel like there is, anyway, great. To the gentleman over here, I don't know. I think with great power comes great responsibility. For us, it's really difficult for us to, we go through life making decisions. We make a lot of mistakes. It's part of life making mistakes. Well, the majority of us is trying to get accurate information from the internet, from sites. It's a matter of exercising our self-determination and our autonomy. We all have the right to do that.
Well, just responding on to the first question about how to show up to a conversation with the doctor where you want to share that you have looked into your condition, that you've asked questions. I think that's actually an interesting question too, to ask ChatGPT of how should I phrase what I'm saying in a way where a doctor would be more receptive to what I'm saying and be less dismissive. So yeah, and echo everything that Dave and Hugo also said in addition. But I know it can be a tricky thing at times, depending on the doctor. And then to the question about education, I think there's a lot from patient peer communities. In hearing Hugo just share the ways in which he's used different LLM tools to ask prompts and have those, ask Claude in figuring out how to best prompt ChatGPT. It's a really interesting method that I actually hadn't used or even thought of. And so I think there's a lot from patient to patient peer learning of the best way to use prompts, of the best way to bring in medical information. Sometimes you might find that your medical records are too long to put into the context window of a particular LLM tool, and so there may be best practices in how do I get all of this information in, and some patients might have figured that out. So I think there's going to be a lot of peer-to-peer community online education on the best practices for patients using LLMs.
He's right. Ask your LLM, how should I introduce my doctor to the fact that I use you? Leave it as an exercise for you.
Grace, the last word is yours. Oh, you're on mute, or we can't hear you.
I'll bite on the first question to wrap things up. I think it also depends on reading the room of where your physician is with this technology. Someone that's more receptive, just dive right in, but do prepare. Just like you would prepare for a business meeting, make sure you have notes, you're prepared, you have your talking points, and keep it succinct, being mindful of the amount of time. In cases where I see that a provider or physician or care team is not as receptive, I may prime with a portal message. I will schedule an appointment saying that this is something that I want to meet and discussing my treatment plan or a care plan, and keep it in the context of the way that your care is being managed. Where the gloves come off is when you're in a life-altering, life-limiting situation, and this is a life and death situation. We're not dancing around. This is your life, this is your care, and this is part of a critical discussion that needs to be had. So don't dance around. And if you don't find a doctor that is willing to do that, it's time to try to find someone else who will be receptive. Also, the nurses and nurse navigators are excellent and often the most empathetic. So sometimes when you're having challenges with your physician, you may be able to see if the nurse may be able to provide some buffering advice. Another thing that I will share is if you're going to tumor board or a second opinion, that's also an excellent opportunity to share some of these findings, because it will bolster and enhance the information that's being provided as your care is being assessed. Don't give up.
Well, I want to give a big round of applause to the whole panel. Thank you all so much for participating with us. And please come chat with us in the afternoon session if you want to do the meet and greet. Thanks all.